All right, now it's time to get in and start to create the nose. So there's going to be three main parts to the nose that we need to be aware of. I'll list them first. So the first one is the lateral cartilage. The next one is the alar cartilage. And the one right after that is just the nostril wing. So those three are going to make up everything that we really need to know or to get done to get the nose in a rough, rudimentary shape. Each one of these later on then has subforms that we need to be thinking about, but let's start with these three forms. To get them, I'm going to use Shadowbox. I'm going to duplicate the Risorius, drop it down, and then go into Shadowbox. Control-click to clear the mask, turn transparency on, and the very first one we want to be thinking about is the lateral cartilage. The lateral cartilage is going to be coming straight off from the nasal bone, coming down and forming a triangle. There is a lateral cartilage. It has two sides, I'll say it that way. There are two sides to it, but we're going to treat it as one block and just cut it right down the middle. Now, you remember from before, there was a way to measure the nose profile if you know what the skeletal orbit looks like, if you know what this guy looks like. You're just taking the measurement, A, and pulling it over so that you got A on the other side. And that'll help you establish the profile of the nose. Now, we're sculptors. We don't necessarily have the skeleton in the right place per se. We're not dealing with the definitiveness of forensic reconstruction, but that's kind of a cool thing to keep in mind and will improve our accuracy and definitely is a level of knowledge that isn't normal to anatomical textbooks. So just makes us look better. Now, with that done and said, let's stay focused on just that one piece. So I'm going to go into Draw. I'm going to use a Mask Rectangle. Just drag out a little shape. Make sure perspective is off. You see the size difference that happens there. Control-Alt. Okay, don't worry about getting it too precise, but we do need to make sure that it's set correctly from a front view. Drop out of Shadowbox. Transparency is off. Divide it once and make sure that it has a very simple pyramidal quality. So by that I mean that we're going to come in, define the front plane, which is going to stay pretty consistent with what we have here in the bone. And then use that to triangulate and establish. Pretty easy to do that. Trim dynamic is all you need. Or M polish, up to you. Something else to know about the lateral cartilage, and this is going to be less prominent on a female, but it does have a really nice shape to it. We can bulge it out and have it come in slightly, and then it meets the alar cartilage, which is doing its thing, and then the nostril wings off to the side. Orbit of the eye, and you're in from there. But we can get this quality in there of the slight bulge. But as I said before, with the female, it's going to be on the smaller side, otherwise you really risk losing the feminine quality. Okay, I am going to flatten everything, so I make this as mechanical as possible, which means I'm going to have to move some things around. You can use the clip brush to do this as well. I'm just in love with the trim dynamic brush. And this is a minor point, but make sure it conforms to the orbit of the eye, the nose. Try not to let it kind of break out of those boundaries unless you really want it to. Otherwise, it's quite easy to have this progress into a large nose pretty fast. Next piece, alar cartilage. So we're going to duplicate the lateral cartilage. Move our duplicate down. We can rename this alar cartilage. Drop into shadow box. And the alar cartilage is going to have a specific kind of conch shell shape. Try to keep them separate if you can. That'll just make it nicer to bring them together. Give them a little bulk at the bottom. All right, drop out of shadow box. And at this point, we just have a couple of simple shapes, nothing special, so divide it once. Symmetry is on. Pieces of the nose. Now we need the third piece, the nostril wing. And the nostril wing in many ways conforms to the alar cartilage. The alar cartilage is a conch shell. The nostril wing is simply a conch shell in the other direction. So why not just duplicate this? Run a transpose line and then rotate it around. Move it in so it's conforming or just slightly breaking that boundary. See the difference? The nasal opening is a really important indicator, the size of the nose, so you got to pay attention to that or at least be mindful as you sculpt. Let's look at it from a side and make sure that we've got that measurement accurate as well. Again, we want to look for the nasal opening. The nostril is going to be slightly outside of that, fitting in somewhere along those ranges. There's obviously room for variation, but you want to find where that end point is and give it just a little bit more room. So this nostril needs to be adjusted a bit. Let's hide our facial markers. They're getting in the way. Okay, there's a couple of really important form changes, or plane changes, I should say, that I want to make sure we're aware of. I've done this all really quickly, and we are going to get in and sculpt each one of these parts in detail, but I want to just provide the structural overview first. So we already noted how the lateral cartilage is largely going to be triangular in nature, and how it has a slight bowing to it. And it can really come in and form a really tight point in between the alar cartilage. So keep that in mind. We don't have that point created yet. I'm not sweating it until we get the alar cartilage in there a little bit more clearly. In terms of the alar cartilage, the shape that we want to start to be mindful of is how it creates its own plane change right here, starting about halfway from the side view. Just try to get the sense as though it's this separate block coming off the nose. Just a very simple plane change. What we're really talking about is this line right here that I'm drawing in red. We're going to want to make sure that that's indicated and separated from where these two touch. Make sure that's a nice flat plane. All right, now in terms of the nostril and how this is going to behave, we're going to have a similar plane change form. I'm drawing in white right now, and then, or red, and then the nostril is going to carve around that point. And then as it comes in, it's going to roll and disappear. So make sure that you get that plane change, which we've already started to indicate, and a nice round connection. Or you could make it a little harder as well, and you get a similar plane change as you do, or a similar step as you do with the nostril. So let's put those into play right now, or just make them a little bit more obvious. So we'll start with the alar cartilage, standard brush. Smooth out one side, smooth out the other, and then give it a nice hit there at the front. And then do the same thing with the nostril. And let's look at the nostril all by itself. I also want to make sure that I'm getting some of the form pulling in to help really complete this conch shell shape. Okay, alar cartilage, we want these guys to touch. Sometimes in order to make them touch, you have to use Transpose Master. Now we can come into our lateral cartilage, pull the nose or the tip that connects these guys down. Let's look at these guys from below. You want to make sure that you get a nice, clean transition for the nostrils. No matter how bumpy they are, what I've got here is wobbly. That's not going to work well in my favor. So a quick tug with the move brush, and we're in fine shape. A little bit of smoothing or trim dynamic. Okay, so pretty simple. There's our nostril. The structural qualities of this are boom, a step, dunk, a step, and then the nostril. Step gets diminished as you go back towards the nasal opening. Nostril gets rounder and softer. The more forward you go, the more planar everything gets. And at this point, we've got a couple of things that we want to look at in terms of the tip of the nose. And this is something that you'll see if you're researching plastic surgery. One of the important things that plastic surgeons have to look for is what's called the tip defining point. This would be the tip defining point. The tip defining point is part of what people really want when they're deciding their nose. Is this point upwards, point downwards? Is it soft? Is it hard? Angular? All of these qualities. What is it that we're exactly looking for? The next thing directly below it is what's called a facet. And that's a square. It's a facet. That's exactly what it's called. And this facet can be used to really augment that tip defining point to create a very elegant nose, a very classic nose. So when you look at an actress who's had plastic surgery on her nose, look for this tip defining point, then look for this flat plane directly underneath it that'll catch the light. And it's usually used to kind of help sculpt that tip defining point and create an architectural quality to it. So what we've got to do is just be mindful. Our tip defining point's a little bit vague and a little bit, how shall I say it? It's just kind of large. Tip defining point and the whole nose here. Let's actually sculpt that whole section. I'm going to show just the skull and the nostril, the mandible. Okay. So that's definitely a hooked nose, and probably not what we're going to be going for in our character. So one thing that we can use as a general rule, the angle of your nasal bone is going to be part of determining the angle of your nose. We're sculptors, we don't have it set, so we're going to change that. But what we want to do is just take a slightly de-inclined angle, and then make sure that we're able to put the tip defining point and the nostrils up to match that. Remember, we've got some serious skin thickness happening here. So my alar cartilage is too low. That's fine. Start with the lateral cartilage, straighten that out. Really work to get it straight. And then we'll come in and fill that void with the alar. You can rotate that alar up if you want. Could be as simple as that. Okay, one thing we missed about the alar cartilage that I'm putting in right now is how this wing is going to come around and insert onto the inside. So you want to make sure that that's lining up there. The nostril, on the other hand, is going to be coming from a different angle, but essentially doing the same thing. Okay, all nice and clean. Now let's get back to that tip defining point and the facet. Then connect our nostril, make sure that that's moving in there nicely. And we've got quite a aerodynamic nose. Let's make sure everything else is visible. See how it fits in. Get rid of those markers. And there we go. Not too shabby. Now you may want to at this point adjust some of the musculature. So you're going to want to get the levator labii superioris alachinesi. Always gets my tongue. Move this closer. Get this right up against. Press Alt. Make sure it's behind that nostril. Can move that nostril outwards a little bit. Okay. Fit it a little bit. Ready for us to go. Now, the next thing for us to take a look at is going to be the eyes. And we're going to start with eyeballs.